You are warmly welcome on SLTV Lab.
Good, let's see ECG recording. In this ECG recording, we are going to see the electrodes placement and we are going to see what we call leads. So there are three terms that we have to know before we see ECG recording. The first one, it is electrocardiograph. You wonder, what is electrocardiograph? Actually, it is the machine used in ECG recording. So it is a machine like this one. This is electrocardiograph. The second one, it is electrocardiogram. The first one was electrocardiograph. Now this one, it is electrocardiogram. You wonder, what is electrocardiogram? Actually, it is the paper of heart tracings or graphs. So it is the paper, that one that comes out of the ECG machine, the paper with heart tracings or graphs. That is electrocardiogram, and it looks like this one. Good. The third term, it is electrocardiography. Electrocardiography. You wonder, what is electrocardiography? You remember the first one was electrocardiograph, the second was electrocardiogram, this third one, it is electrocardiography. So this is the whole process of recording the electrical activity of the heart. That is electrocardiography. The whole process, taking the machine, using it to record the ECG, that is electrocardiography. It's good. Now you wonder, what is ECG for? What is it for? It is for recording the electrical activity of the heart. I'm saying the ECG, it is for recording the electrical activity of the heart. Good. Please, it is not used to record the mechanical activity of the heart, such as contraction, no. But the electrical activities of the heart predict what happens mechanically. I think you get it now. So guys, therefore, you need to know the conduction or electrical system of the heart before we see ECG recording. This electrical activity of the heart is made up of SA node, you remember AV node, bundle of His, bundle branches, and Purkinje fibers. Good. There are different types of ECG. Like this one, it is fixed. You can find them in the hospital or you can find them in the ambulances. There is another one like this one. It is portable. You see, it's very small. You can take it at your patient's home. You can move it from one place to another, just like that. Those are some kind of ECG. There are other kind of ECG, but you should know ECG is not one machine. There are so many types of ECG. Now let's see parts of ECG. This is our ECG. So these are the electrodes. These are the ones that placed on the patient's skin. Here it is the screen. Below the screen we see the control buttons, and there is the printer of ECG, and these are the electrode cables. The other electrodes are reusable electrodes. You use them more than once. Use them on one patient, you clean them, and then reuse them on another patient. These kinds of electrodes are reusable. Now let's see the electrodes placement, where we place the electrodes. Let's see where we place electrodes on the rims. or limb electrodes. The first one, you place it on the right arm, then left arm, left foot, and then there is a neutral electrode pressed on the right foot. Now let's see the placement of chest electrodes. The first electrode, it is C1. It is placed at 4th intercostal space. That is the space between the 4th and the 5th rib, at the right edge of the sternum, just at the right edge of the sternum. C2, it is placed at 4th intercostal space, but left edge of the sternum. C4, it is at the 5th intercostal space at the level of mid-clavicular line. Then C3, it is between C2 and C4. Now C5, it is at the same level as C4 at anterior axillary line, while C6, it is at the same level as C4 and C5 at mid-axillary line. Good. So now this is how the electrodes placement looks like on the patient's skin. Let's start with the rims electrodes. The electrodes on the rims. You remember the first electrode, it is placed on the right arm. You see, it is just above the right wrist joint. The right wrist joint. The second electrode, it is placed on the left arm, just above the left wrist joint. The third electrode, it is placed on the left foot. It is not exactly on the foot, but above the ankle joint, just here. Then there is another electrode, it is neutral. It is placed on the right foot at the same level as the electrodes on the left foot. Those are the placements of electrodes for the limbs. Now let's see for the chest. Remember, the first electrode, C1, it is placed at the 4th intercostal space, right edge of the sternum. The sternum passes at the midline, at the median line of the body. So here it is the right edge of the sternum. So the 4th intercostal space, it is at the same level as the nipple. Good, you see, at the nipple. Then C2, they are at the same level as C1, but it is at the left edge of the sternum. Good. C4, it is at the 5th intercostal space. You see, here it was 4th, below here it is 5th intercostal space. But at which level? We call it at the mid-clavicular line. This is the clavicle. Just when you take the midway of the clavicle, just in the mid lane of the clavicle, you draw it downward. It is an imaginary line, you can't see it. That is where you place C4. Then C3, it is just placed between C2 and C4. There is no exact location, but at the mid distance between C2 and C4, that is where we place C3 electrode. Now let's see C5. C5, we say you place it at the same level as C4, but at which position? This is the armpit or the axilla. This is the axilla. The axilla, it is the armpit. Just at the anterior edge of the axilla or anterior axillary line. That is where you place C5. 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 Then C6, you place it at the same level as C5 and C4, but at mid axillary line, just at the mid row of the axilla. Here it was the anterior, there should be the posterior. Then here it is at the mid axillary line or the mid row of the armpit or axilla. So that is the position where you place the electrodes. On this big diagram, you can see it clearly. V5. You see? Anterior axillary line. Absolutely, it is at the edge of this big muscle on the chest. We call it pectoralis major. So at its edge or lateral edge, that is where you place C1 electrode. Then at the mid axillary line, just in the middle of the axilla, that is V6 position. I think you see it. That is V6. We are going to see what V stands for. We have seen C, but we're gonna see what V stands for. So guys, there is something I would like you to know here. The ECG has 10 electrodes. Keep that in your mind. But in ECG we get 12 leads. Then we're gonna see what is the difference between electrodes and leads, and how comes that we get 12 leads when we have just 10 electrodes. And what is the difference between an electrode and a lead? Now let's see. Electrode, it's a conductive part attached to the skin in order to do what? In order to record electrical current. That is what electrode is. As a lead, it's just the voltage difference between two points, either two electrodes for what we call bipolar leads, or between a virtual point and an electrode. That is for unipolar leads. So very soon we're gonna see what is bipolar and what is unipolar lead. Let's see the 12 leads. First of all, there are 6 limb leads, 3 which are bipolar. In the bipolar we have lead 1, lead 2, and lead 3. You get it? In 6 limb leads, 3 are bipolar. Then we're gonna see what are the others. And then other 3 are unipolar leads, all named as augmented voltage leads. We have AVR, AVLO, and AVF. AVR stands for augmented voltage right arm lead. Then AVLO stands for augmented voltage left arm lead. Then AVF stands for augmented voltage left foot lead. Those are 3 unipolar lead. Adding other 3 bipolar leads, then in total there are 6 limb leads. Then we are remaining with other 6 leads. The other 6 leads are called chest all precordial reads. Those are the ones from the electrode attached to the chest. There is V1, V2, V3, V4 up to V6. Now let us see the reads in details. Here is the heart. Then here is the vector for read 1. Read 1, remember, it's one of the 3 bipolar limb leads. So read 1. So lead 1 has a negative side, which is the right arm electrodes. Then the positive side is the left arm electrodes. Here is lead 2. For read 2, the right arm is negative as well. Then the left foot is positive. That is lead 2. Read 3. For read 3, the left arm is negative. And then the left foot is positive. It's very clear here. For both lead 2 and read 3, the foot is positive. Good. Now let's see the unipolar limb leads. We start with AVR, augmented voltage right arm. This is a unipolar, so this is positive, positive. The right arm is positive, positive. For AVR, or augmented voltage left arm, also it is positive, positive. The same for AVF, or augmented voltage foot, it is positive, positive as well. This is about the limb reads. Let us see 6 chest or precordial reads. We start from read 1, which is called V1. Then there is V2, V3, V4, V5, and V6. They are unipolar leads as well, because they measure the voltage difference between one electrode and another virtual or imaginary point. Here, each reads measure the voltage difference between its corresponding electrode and the voltage difference between the remaining reads, the remaining 5 reads. Let's take an example. V1 read just measure the voltage difference between C1 electrode and the voltage difference between the remaining 5 reads, V2, V3, V4, V5, and V6. And the center of all remaining chest read is called Wilson's central terminal. Good. And these are 6 chest or precordial reads. So guys, you cannot see the leads physically. You only see them on electrocardiogram or ECG paper when it is printed out. So it will look like this. Here is lead 1, all first bipolar limb lead. Then lead 2, second bipolar limb lead. Read 3, or third bipolar limb read. Then we see there are 3 unipolar limb leads. There is AVR, or augmented voltage right arm, AVLO, augmented voltage read on the left arm. Then AVF, augmented voltage left foot read. Then we're gonna see 6 more reads. Those are the precordial or chest leads. There is V1, or first chest lead, V2, V3, V4, V5, and V6. You see, these are 12 ECG reads.
Please support this channel by pressing like, subscribe, and the bell. This is a huge support for this channel. May God bless you.